Welcome to Talking Health with Bumi, your go-to program on health matters, and thanks for joining me. Today, we'll be diving deep into the complexities of mental health, such as when is someone considered mentally unstable or having a mental health issue? What pushes one into that psychological state? What are the stages, actually, of mental illnesses? How can such people be helped? How can one even know to start with if one is mentally challenged? How can the person then break from the stigma? These are part of the plethora of questions we'll get to discuss in this edition. But before I introduce the expert extraordinaire that will do justice to this very critical societal challenge, let's see this short report on mental health. Please stay tuned.
As at May 2021, according to the National Library of Medicine, Nigeria, the seventh largest country in the world, has Africa's highest caseload of depression and ranks 15th in the world for the frequency of suicide. By April 2023, the World Health Organization, WHO, stated that about 20% of Nigerians, or around 40 million people, are affected by mental illness, with the most prevalent of such including depression and anxiety disorders. Globally, about 970 million people struggle with some mental illness or drug abuse, while 1 in 4 people will be affected at some point in their lives. Data shows that 14.3% of deaths worldwide, or approximately 8 million deaths each year, are attributable to mental disorders. With less than 150 psychiatrists in the country of over 200 million people, only about 10% of mentally ill Nigerians have access to the care they need. The burden of psychiatric disorders worldwide is huge, and it does not spare low and middle income countries such as Nigeria, where the burden of disease is currently great. According to WHO, 1 in every 4 Nigerians has mental illness. Although the Nigerians' mental health policy was formulated in 1991, it did not make adequate provision for the much-needed community-based psychiatric care. With only 7 government-owned hospitals, that is, within reach of the common man, psychiatry facilities in the country are always overwhelmed. Thus, there is the need to overhaul the existing policy and emphasize the urgency of a shift from inpatient psychiatric mental health care towards a community-based, multidisciplinary psychiatric healthcare system. Globally, many people who experience mental illness are reluctant to seek help because of the stigma associated with it. Although the specter of stigmatization negatively impacts seeking help, there is little information about the nature of the associated factors that govern the avoidance of mental treatment. It is notable also that unmet needs for mental health treatment are particularly commonplace in low and middle income countries.
Welcome back and thanks for staying tuned. Those statistics are mind-boggling. So connecting with me virtually to speak to this critical issue is Dr. Maimuna Yusuf Kadiri, popularly known as Dr. May, the celebrity shrink. Dr. May is a decorated and a multiple award-winning mental health physician, advocate and coach with almost 20 years experience as a practicing physician. She's a medical director and psychiatrist-in-chief at Pinnacle Medical Services, Nigeria's leading foremost psychology and mental health center, prominent in the application of innovative clinical approaches in the management and treatment of a wide range of psychological, emotional, behavioral, and mental health-related disorders. Dr. Kadiri is a fellow of the National Postgraduate Medical College of Nigeria and a trained and certified rational, emotive, and cognitive behavioral therapist, from Albert Ellis Institute, New York, USA. She is also a certified trauma counselor and neurofeedback practitioner. Currently, she is undergoing a master's in digital healthcare at Barcelona Technology School. Wow, that's intimidating, doctor. Welcome to Talking Health.
Thank you very much. And hello
If I have to go by your resume and all those details, we will be halfway through on this program.
We are good. We are good. Hello, everyone. And thank you.
Thank you. Thank you, Doctor. For your information, viewers, Dr. Kadri is joining me right now. She's at a conference in Botswana, but she had to make out time to speak with me today. So without wasting much time, Doctor, let's go right into why we're here. Really, as a medical practitioner par excellence, how do we define mental health?
That is a good way to start this conversation, because it's always good for us to know what the normal is before we go into the abnormal. And when you know what the normal is, when we start talking about the abnormal, you can easily relate, and then it will give you a clearer picture of what mental health versus what mental illness is. So what is mental health? According to the World Health Organization, they have defined mental health to be the ability. So I'm going to be really highlighting very key words. They've defined mental health as the ability for individuals. So you, I, any other person that is listening and watching us right now, the ability for you to, number one, realize your potentials in life. Number two, the ability to deal with the day-to-day stressors of life. Number three, the ability to work productively and fruitfully. And last but not the least, the ability to give back to the society or give back to your community. So this is what mental health is all about. And it's telling us that mental health is not the absence of a mental health disorder. So there's a distinction between mental health, which, by the way, we all have. But what we do not all have is mental illness, because it's a medical condition, it's a medical challenge, it's a medical disease, it's a medical disorder. So while we all have mental health, as much as we all have physical health, because both of them are intrinsically and interwoven together, we do not all have mental illness, because that is a disease condition.
Terrific. Thank you for that clarification. Now, how can one know when or if one or someone around one has mental illness?
Good question again. I would say, how do somebody know that you have mental illness? What are the signs? What are the symptoms? One thing I want to let everybody know is change. That is a watchword I want everybody to know. Who am I today? Who was I yesterday? That today I notice a change. And if I do not take the requisite steps or do the necessary thing, it may escalate tomorrow. So that change could be you, it could be somebody around you. So is the word I want us to know is change. And that's what we classify as symptoms. I have headache. You have a head, but you do not have ache. So, and that when you bring the two together, you now say headache, because the head is there, you didn't have pain, but all of a sudden you just notice there was a change. Your head is banging, maybe you're not seeing well, and it's okay, why am I having this headache? So what are those common signs and symptoms when you realize there's a change? Change in mood, which can be what people call mood swings, high mood sometimes, low mood sometimes. Change in appetite, either eating or not eating well or eating too much. Change in sleeping pattern. So either you are not sleeping well or you have poor quality of sleep or even oversleeping. That is one, these are some of the things that are very common. Change in mood, change in appetite, change in sleeping pattern. But what are the other things that are also very relatable? I define that mental health is the ability to deal with the day-to-day stressors of life. Yeah. Inability to start dealing with the day-to-day stressors stressors of life. It's a symptom. You are not able to cope anymore. You're not able to deal with the day-to-day stressors. That is a symptom. Another symptom is you feel confused thinking, or reduced ability to concentrate. You are holding your phone, you are looking for your phone. You are holding your car keys, you are searching everywhere for your car keys. These are so mundane and common, and you're wondering why. These are symptoms, but I would say when you start noticing when you should start getting help. So
Yes.
those feelings of low mood, change in mood, appetite and sleep, feeling confused, poor concentration, excessive fears or worries, or extremely feeling of, guilt. You start feeling that there's something wrong. I didn't do this. I feel guilty about it. Or that excessive fears or worries. Or even, withdrawal from friends. Withdrawal from family members. You don't want to go out. If you are the whole one person, you are no longer interested. Like as a broadcaster, you are no longer interested in your craft anymore. So loss of interest in things ordinarily you love to do is a symptom. Detachment from reality, inability to cope, like I said, with the day-to-day stresses of life, major changes in your eating habit, sex drive changes, either increase in stress and in sex drive or decrease in stress drive. We talk about loss of libido, and of course, excessive anger, hostility or violence, taking risky behaviors. It can be as bad that it gets to a stage when you start having hallucinations, like hearing voices in clear consciousness, seeing strange things in clear consciousness, or having delusions like paranoia, believing everybody's against you, somebody is going to kill you, or grandiose delusion, believing that you are Buhari, or you are Tinubu, or you are believing that you are a president, a governor, whatever. So those kind of delusion, or you start having disorganized behavior, and it can be as bad as you begin to start having suicidal thoughts, suicidal ideation, or even wanting to harm yourself. So all these symptoms have said a day or two may not be an issue, except the very severe ones of delusions, paranoia, suicidal thoughts. But change in appetite, mood, sleep, a day or two, we are not talking about that. But when it becomes it prolongs, the frequency has increased, the duration has prolonged, then you start thinking there's a problem, because it might have started affecting your productivity, it has started affecting your interpersonal relationship, and it has started affecting your day-to-day activities. So these are the very common symptoms when we talk about what are those warning signs, what are those things we should look out for that can affect our mental health.
Wow. That's a lot to digest at once, really. So I know that there are usually misconceptions about virtually everything. Okay, so what are some misconceptions about mental health that you have encountered in your professional life?
A lot of misconceptions. And
Let us
most
in
times when I
there
go out and I'm
into
talking
them.
about mental health, I tell people that the way our mental health has been projected in the media is that person out there who is wearing dirty clothes or not even wearing clothes at all, eating from the dustbin, fighting people. No, that one person that you see that we call vagrant psychotic is just 1% of people that have mental illnesses. 99% is you and I. And I've labeled it, or not labeled, I've coined a word for it. We call it package madness. We all look good. Nobody knows what is wrong with you, right? But we are
Madness.
packaged. Yes,
oh my.
Look at me looking all glam with lipstick, with my turban. Do you know whether I've taken my antidepressant? No. So when people start talking about this person is this, I just laugh. I said, go for assessment first before you start pointing fingers. So what are those common misconceptions about mental health? Or is witchcraft, is a spiritual attack, people are doing me? No. Mental illness are just like other medical conditions. In fact, they are grouped under what we call non-communicable diseases. And what are the non-communicable diseases? Hypertension, diabetes, obesity, cancer. So why do we sympathize with people that have hypertension, diabetes, and cancer, and we stigmatize those people with mental illnesses? And that's because of we do not have much knowledge when it comes to mental health and mental illness. So yes, people, the misconception is a spiritual attack. I've done something, the gods are after me, Amadioha will kill you there, Ogu will kill you there. Those are some of the misconceptions. Another misconception is that people believe that it's those that are weak that have mental illness. We've had presidents that have gone on admission. We have presidents, we have governors, we have ministers, we have senators that are taking antidepressant, psychotic because they have issues. So it's not about whether you are weak or strong. So that is another misconception. Another misconception is that people with mental illnesses are violent. That is a no-no. In fact, it's the other way around. People, anybody can be violent. Anybody can throw tantrum and get angry and attack people. In fact, people with mental illness deal with themselves, they query themselves, they get angry with themselves because they don't understand what they're even dealing with. They don't attack you. The only reason they will even attack you is because you are trying to attack them, believing that they will attack you. So they are defending themselves. So they are not more violent than the normal person out there. Another misconception is that mental illnesses are rare. They are not rare. There are other, like I said, the non-communicable diseases are common. Mental illness, in fact, 1 in 4 individuals will have a mental illness in their lifetime.
Wow.
1 in 4, meaning you could have had it or you're having it now, you have it in the future, because there are many reasons why you can have mental illness, and I'm sure we'll get into that. Then people talk about that they are permanent. They are not permanent. They are treatable, beatable, and manageable. Hypertension, diabetes, we say they are permanent. We say cancers are permanent. Most medical conditions are treatable. They are not curable. There's a distinction. Curability is different from treatment, so they are not permanent. Other people also think that children do not have mental illness. Now, this is where it gets interesting. Half of all mental illnesses start before the age of 14.
What?
Half of all mental illnesses, 50% of all mental illnesses start before the age of 14. So children do get depressed. Yes, children do get depressed. There are many reasons why children can get depressed. Coming from a home where there was violence, maybe being sexually abused, death of one or both parents, positive family history of mental illness. So half of all mental illnesses start before the age of 14. So children can also get depressed. And another misconception is that people will say you can easily snap out of it. You can't snap out of it. This is not like wake up, sleep and wake up. No, God get help. They are treatable, they are manageable. Another misconception is that only medication that they use in treating mental illness. No, there are many options in managing people with mental illnesses, as much as talk therapy, which we call counseling, psychotherapy, cognitive behavioral therapy. So it's not about medication. We can just talk. Sometimes you may never get to a professional, talking to a trusted family member who will listen to you, not judgmentally. And then, of course, one other very common one is the fact that, it's only weak people that seek for help, or it's only people that are weak that seek for therapy. The truth is that each and every one of us deserve to have therapy in our lifetime. We've been traumatized. We are just normalizing nonsense. We're just, we've come to a stage where we're in abusive relationship with certain things that we think are normal. Like Lagosians, we think that traffic is normal. It's not normal. You are in an abusive relationship. If you go to a place where, that's why when you will not go to a place where there's so much calm and serenity, you're like, oh, this place is boring. It's Lagos people that will go to Abuja and say it's boring. Because there's no chaos there. We are beginning to think that chaos is what makes us thrive until you go to where there's serenity. So these are some of the misconceptions that we have about mental illness. Mental illnesses are treatable, beatable, and manageable, just like most medical conditions. One thing is that most medical conditions are not curable. We've been able to cure malaria. Just let's start discussion. So they are treatable, they are manageable, and beatable. So, but these misconceptions are very important for us to know that they are still myths. They are not facts. They are myths about mental illnesses.
Thank you so much, Doctor. So this is where we draw the curtains of this week's edition of Talking Health with Bumi. Should you want to contact us for questions, comments, or sponsorship inquiries, please do not hesitate to do so via the number scrolling or send us a mail at info@kongatv.com. Until next time, think health matters. Think talking health with Bumi.